good morning, good afternoon, good evening, wherever you're joining from. Thank you very much for making the time to be here, to be a part of this conversation on AI in healthcare, which is a very important topic because healthcare is an important right of people, wherever you're from. It doesn't matter your skin color, it doesn't matter what race, what religion. Healthcare is important and it needs to be accessible to everyone. And that is why this topic has been chosen, because it's very close to my heart and the hearts of the different panelists who are joining us today. And to help me out with this conversation and to drive it forward, I have 4 other interesting panelists. And in no particular order, I'm just going to start by introducing the first panelist, Rachel Harris. Ms. Harris is a Deputy General Counsel at SUSE Incorporated. She was CIPP-US, so she's a privacy professional. She navigates the complexities of AI governance, a lot of work to do with privacy, regulatory compliance, cybersecurity, aspects like that. And she's a regular speaker at industry conferences and events where she shares a lot of insights on how AI is changing privacy trends globally. Thank you very much for joining me today, Rachel. Next, we have Kate Carter. She is a PhD candidate, and her work, her research is centered on artificial intelligence, ethical AI development and implementation. I know her through the Mission Impact Academy, where she serves as an AI strategy and student success manager. And she is leading initiatives to empower 1 million women in AI and emerging technologies by 2030. I think that is amazing. So thank you very much, Kate, for your time and for being here today. Next, we have Britney McGill. I'm not going to try and pronounce the last name. That's going to be tough for me. So I'm just going to say Ms. McGill is a clinical operations manager. She's an AI prompt engineer. She's a GPT architect. And most importantly, something that caught my eye is that she has many years of experience, of dedicated service in the nonprofit sector, where she is passionate about driving nonprofit success and community impact. Thank you very much for being here, Britney. And last but not least, the only man on the panel, we have Dr. Yudara Kularathne. Thank you very much for being here. So Dr. Kularathne is a renowned consultant emergency physician, but what's even more interesting about him is that he's an AI innovator. In 2022, he moved out of academia and he set up a digital diagnostic startup, which is called HeHealth, where, and I'm not going to give too much away, but he uses AI to help men with their health situations. Let's keep it at that, and let's hear from him later on during the session. So thank you very much for being here. Thank you to all our panelists for being here, and for everybody who's joining us at this point to engage in this conversation with us. So without further ado, I thought I'll jump right into the first question. What I will do is, in the interest of time, I will pose the question, and maybe 2 people at a time can take up and answer each question. And if we have time, we can take maybe a third or a fourth based on how the time goes. All right, so the first question we're going to go into is on digital health literacy. So my question is, how can we improve digital health literacy among patients to ensure that they can effectively engage with AI-driven health technologies? And here I would like to just get a bit of an idea of how you feel digital health literacy is in the countries you are from, and whether or not there's a lot of room for improvement, or how are they in terms of engaging with new tech in terms of healthcare. So that is the question. Anybody who is comfortable to jump in and start answering, I'm good with that.
I'll jump in because I hate awkward silence.
Okay.
Yeah.
Yeah. Okay. All right.
So with with digital health literacy, and I'm coming from the lens of being in the US and being a person of color, I think overall there's a lot of mistrust within the healthcare system. And when it comes to introducing new technologies, there's already mistrust, not only with the healthcare system, but with the technology itself as well. And so it's like a double-edged sword. And I think the only way, or one way, to help with digital literacy within the African American community or people of color is to really take a different approach, think outside of the box, do things like educating hairstylist and barber stylist of maybe an AI tool or solution. Because when I getting my hair braided, let me tell you, I'm sitting in that chair for 13 hours. And this is with a person that I trust already because they're doing my hair and we have a relationship established already. And so it's just an opportunity for them to slide in a little bit of knowledge, and it's not being taught down to me. It's like, hey, I learned about this new thing, or I've heard you can check out diabetes this way. Things that are really impacting our communities. Or hey, have you had a mammogram? There's some new solutions out there. And I think it's a novel way to kind of take a different approach to gain trust within a community that's already feeling like, I don't trust doctors, I don't trust this healthcare system because they've experimented on us. And this is a person that I do trust. And so it's a different way to look at it, but I think that is a way to kind of tackle this issue.
Thanks, Kate. I have to jump in.
Yeah.
By the way, Tanuki, I'm going to jump in for every question because I'm the only guy who here. So I have to represent like 50% of the
Yeah,
men's.
sure.
I'm just kidding.
Of
Anyway,
course.
Kate, what you said is so powerful. We actually did a project because I come from the background. I'm a physician. I work on the sensitive topic of sexual health and AI, which is a very, very niche area. And we thought about the exact same thing. Not only that we thought about it, we actually use for men, barber is a very important part. You know, they trust like what you said, and they spend some time, and then it was so easy. We actually did the project. We disseminate information through barber, and then we even write a paper on this and we publish it. Because that's a trusted way of getting thing. And then this, you don't have to do much. You just get the barber hold for half an hour and then tell them, okay, guys, this is what it is. And they are usually also very interested about when we talk about the thing. Everybody was like, okay, I want to understand about this solution. I'm particularly talking about my own startup, HeHelp. That was a very successful way of we getting the information in a non-stigmatized way into the population, the local population we were working with. I have to, yes, say that was one of the coolest ones we have done.
Yeah, I think it's so interesting because when we frame the question of digital literacy, I think it's this fireside chat is so critical because of the different perspectives, right? And that we're going to have on it. Because my mind, the privacy, AI governance lawyer immediately went, yeah, choice and consent. Is that even still a thing that is valid in the emerging technologies we see? And so to your points, it's exactly that. Not only is it, meeting people where they're at with trusted partners to explain this technology is out there, but also what it means to them and their data and their ultimate, healthcare profile, if you will. So informing them of the technology, but also informing them and empowering them with the knowledge of how is that data being used? What transparency do we have around it? Where is it going? Those sorts of things, I think, is key as well to digital literacy.
And I
Very
just
true. I agree. Yes, Brittany,
I
you
wanted
can jump
to
in.
chime in at the end and kind of piggyback exactly what Kate and Rachel said. Perspective is very important. And I think that's why I'm such an advocate for more Black and Brown people learning these systems and using these systems. Because when we're talking about educating people, it's exactly what Kate said. People want to be educated and learn from people that they trust. And who better to trust than somebody that you're comfortable with that has lived experience, that shares lived experience with you. And so that's why it's so important that we're advocating for more Black and Brown people, more women, more minorities to use and educate people on these tools.
Yeah, use them and be involved, at the companies that are building it too, so that there is a person that you trust that understands what's actually going on under the hood or behind the scenes.
Absolutely.
Totally agree. Yeah.
All very valid points. I do agree very much with Rachel's last comment, is that need to have that kind of representation at the point where these tools are being designed and developed, because if that representation is not there, that voice is most likely not going to be factored in. So yeah, definitely. And that leads into the next question quite well, which is, now we're not just talking about building trust in terms of the patient or the user of the tool, we're also looking at what strategies can be employed to build trust in AI technologies among the healthcare providers and patients, kind of within that relationship, is my next question. How do we create a level of trust there so that both these parties are willing to use it and also kind of trust in the outcomes and discuss a way forward in terms of their healthcare journey? Who would like to start?
I'll start there. I think when we're talking about trust, I like to look at trust across the board. I'm not going to trust you to use the AI program or system with me if I don't trust you in general. And so I think it's very important that as a healthcare system, as providers, as clinicians, that we're making sure that we're building trust in general with our clients and with the people that we serve. Once we build that trust and we build that relationship, heavy on relationship, once we build that with our patients, they'll be more apt to be open to different AI systems, but the relationship and the trust has to be there from the beginning. So I'm looking at it from a standpoint of not just coming in with AI, but in general, how well do your patients trust you with literally their livelihood? That's what's important to me.
Yeah, and I view key what Brittany just said of like relationship being central. I think that relationship has to also stem from a place of transparency, right? If you want to get to trust, you've got to have transparency. And I think what's interesting is we've seen recently, there was a settlement that came out of the state of Texas recently against an AI healthcare provider for false and misleading claims. And what was central to it was that there were certain marketing claims about the accuracy of the AI that the providers were being told. And of course, if the providers are being told that the accuracy is super, super high with this AI, then that's going to trickle down to the patients. So I think that transparency we're talking about to establish that trust relationship Brittany mentioned also has to start at the developers and deployers of the AI tools in relationship to the provider. The provider has to have full transparency from those technologies and the people building them so that they can relay that transparency down to the patient.
I was speaking to a CEO of Ferrum Health yesterday or the day before yesterday, and their AI solution is to help catch medical errors, which is a leading cause of death here in the US, but it's not often talked about. And their solution is really interesting because it is deployed in the background, and clinicians, radiologists, no one even knows that it's running. So it's running and looking at like CT scans and MRI scans for lesions of cancer. And then also comparing it to the doctor's our SOAP notes. And so if that doctor missed the lesion, it then is flagged. And so a lot of obviously, like, we don't want to be pointed out like, hey, I missed someone's cancer diagnosis. And so to help navigate around that, their solution is to have an expert team of individuals that also can read the images, and there's no trace of who that actual doctor was. So it's never to call out a doctor for missing the error. It's just like, hey, we've noticed this might be a lesion. Let's do a follow-up and check out. And so I think it's a great way because it's hard for us clinicians that are out there busy practicing to adopt any new solutions. Like, we are already flooded with the work that we have to do, the amount of patients that we have to see, the documentation that we have to see. And so to have it be seamlessly integrated in is, I think, a great way for clinicians to build trust. Like, hey, I know this is running in the background to just help me, just in case. kind of deal. And I'm sure the patients aren't even aware, right? That their CT scan is also going to run through some type of AI widget software. So there's multiple ways, but I think that it is one way to not add extra burdensome on us clinicians out there practicing, because it's already too daunting. It needs to be an easy, transparent process that's taking place within the background.
Thank you.
And again, I have to add this. Yeah.
Yes.
So,
yes.
Rachel, by the way, it's really nice to have you here because you bring a very important part. The communication is the way to forward and discussion. I'm going to wear different hats slightly because there's two aspects of the trust. One is inferred through the government. For example, you said like you are HIPAA certified, then it brings certain amount of trust with that. People just look at the label and think, okay, I think I can trust. But I bring a thing from a very different point of view, because again, I build an app where people can upload a penis picture, which is a very sensitive area. And you have to really trust that people who you are sending the image will not abuse this. And when I started this, clearly, when I look at the legal aspect, there was no guidelines for us to follow because I'm the only one in the world at this moment running this app. And of course, we had lots of legal trouble, but I, as a physician, had a very basic principle to guide me through. I always tell this, which is to do no harm. I look at the legal aspect, which is actually not robust enough at this stage. And I thought, as a physician, the best I can do is to give all the information necessary for the people to understand them. Instead of you infer, we empower them to trust. And then that's where the transparency comes in. And surprisingly, a lot of people, when I first think about this idea, one of the investors said, Yudara, don't even think, nobody will send a picture to you. You are nobody, you are not known. But I have more than 100,000 people directly use my app. And because of the way I communicate this, and of course, even HIPAA was not robust enough for me to protect the patient's privacy, I went few steps ahead. So that way, we communicate it and then say, look, this is how we do it, and then it's up to you to make the decision. Nobody forces you, but you read the details and then understand it, and then you make your own consent and then make the decision. I think these are very important facts. And when I get again invited, I thought this is very important for me to jump in. Number one, to represent all the men from eHealth. And jokes apart, but give that context, because this is a evolving area and a lot of technology change so fast. I don't think governments, legal systems are able to keep up to that speed. When people who are in need, so we empower them, then it's good enough for them to make decisions, instead of you trying to put them everybody in a population level and then put a blanket rule and say, okay, this is HIPAA compliant or not, something like that. Not that I don't want these things. That's the baseline you should have. On top of it, you must have robust, new, knowledge-based, trust-based, mechanisms to empower the patients.
Right. Thank you very much. Those are all very valid thoughts. And there's a question from the audience, which is very much related to what we were talking about. So the question is from Nashia: how do you build digital trust? And to build digital trust, organizations must focus on security, reliability, privacy, transparency, and proactively protect against cyber threats. What are the priorities? I'm going to, in the interest of time, put this question to Rachel. Do you think you can give us a brief answer on this?
Yes, I think in the age of AI, priority number one for me is transparency, because the rest will follow. If I had to pick between those, it's transparency. Has that evolved since, 10 years ago? Yes. But I think to get at security, reliability, privacy, and I would also add like bias mitigation and other items, transparency has to be forefront throughout the life cycle of the people who originally build the AI to technology companies layering that technology into their evolving stack to deliver technologies to physicians and then ultimately to the patients. We need transparency throughout the system.
All right. So I hope that answered your question. I think that was a valid point to be made. So there was something that Kate brought up before, so I'm just trying to make a connection to a different question that I had, and this is more on healthcare professionals. So I think what I want to ask is, given the growing complexity of AI systems, what steps can be taken to ensure that healthcare providers have the appropriate level of understanding without overburdening them with additional training and additional responsibilities? And I think this is important because on top of the bulk of work and decisions that they have to make on a daily basis, we're adding another layer of things to think about at this point. So I would like to just get like very quick perspectives on what you think, like maybe a strategy or two that you think we can pose at this point. Who would like to jump in first?
I will, since I'm out there in the real world practicing. I think that the CEO of Fair and Health has a great solution that it's running in the background. And I think that if you're able to then market like your hospital system, right? Like you have a gold star on your sliding glass doors when you walk in, you know that behind the scenes, we have AI systems that are just helping double check, cross check, maybe rule out or rule in things that might be missed by humans there. And we understand this rating system that maybe there might be trust. It is really hard to integrate new tools to clinicians because we are so busy. And so I worry that we think we might have like this easy end-all answer. We're just going to deploy it, and then clinicians might become lazy and reliant on it, as if it doesn't hallucinate, as if we won't run into problems that way, and cause more medical problems. And so I think it's really important to just have someone that is AI literate within that team environment, because I'm in physical therapy realm, that's like keeping abreast to what's happening regulatory wise or law wise, or maybe new tools that are being introduced, and then can educate that team. But that you always have that human in the loop saying like, hey, we have this, we always have to double check, because there's not going to be this end all like sweet answer that gets it right 100% of the time. And so I think it can go both ways. There are great solutions out there to help with documentation that can just help speed up the process, help increase billing opportunities, see different words, make sure you're billing correctly. And those are great answers for clinicians, because the administrative load of healthcare is daunting. But yeah, there's not a one size fit all answer to this question.
I think also too, I want to piggyback off something Kate said there. It's important that people that are educating or training clinicians on AI, I think the way we say things makes a big difference. And so there's a fear, an inherent fear that AI is going to replace us, or it's going to take your job. But I think it's important that we change the lingo or language that we use. AI is here to enhance or make you more effective. It's not here to replace your human knowledge. And so I think the language that we use towards educating and introducing these solutions to clinicians helps a lot. It kind of alleviates that pressure, because in my mind, if I'm thinking AI is going to replace or may possibly put me out of a job, I'm already stressed when I'm using these solutions. I already may not be as open to using AI solutions. So I think the language and lingo that we use is important. It's here to enhance. It's here to make you be more effective at what you're doing.
Yeah, those are very valid points. Thanks, Britney and Kate. If any of the other two would like to add something, if not, I'll just jump on to the next question. Yeah, all right, okay. So the next question will be in two parts. I'm trying to take them together in the interest of time. So it's on training data and bias. So the first part would be, how do we ensure that the training data used for AI systems is representative and free from, I mean, I don't think we can ever say that it'll be free from bias, but, to a great extent. And I would like, when you're explaining this, if you have any personal experiences that you could share with our participants, would be great. And part two is instances where bias has affected AI outcomes in healthcare, and what steps can be taken to mitigate this issue. So you can either answer both parts, or basically, I would like to hear with some personal experiences, if any.
Yeah, I can jump in real quick. I think this this is key to all discussions of AI, right? And I think now is a pivotal time for us to really think about, all of us here right now at the Fireside Chat, but to think about AI in what context. So generative AI is what most of us talk about when we start thinking of training data and bias mitigation. And so in the context of a clinical setting, an easy example could be, let's say there is a generative AI solution to help, to Kate's point earlier, catch errors, say, in readings of mammograms and detection of cancer cells in mammograms. Well, if all of the training data that went into the initial large language model built by the developer was leveraged using public data, we know there's going to be inherent biases in that, because as a public at large, there are inherent biases, right? So then you think about, that's the original large language model. If the then deployer of the technology to create this generative AI solution to read mammograms takes its own data set to speak or layer on top of that large language model, we have to ask, are there inherent biases in that other data set? Example, in the US, most mammograms are only done above a certain age level. So how good is it going to be in detecting or reading mammograms under, say, the age of 40? Or if your representation of the population that actually gets mammograms doesn't adequately represent, say, people of color, you're going to have inherent biases in its ability to read the mammograms, detect it, et cetera. So I think the key to everyone's point on the last question is, you need those subject matter experts that are humans involved in the analysis of the generative AI solution to enhance what everybody's doing, but you also need them to ask those questions, because they'll know. They have firsthand experience of, well, mammograms are only over this age. Well, we don't have adequate representation, et cetera, et cetera.
Yeah,
I think
Go ahead.
okay. I'll add, I have a real life experience which affect me myself. So when we build the first model to detect the STIs, we use publicly available data, like Rachel said, plus some of the data we got it through our partners. And me as a Brown founder, I specifically look for biases on the first model itself. And then I realized the accuracy rates for brown skin and dark skin, basically people of color, have significantly lower in the model. I was like, no, I'm not going to release this model, and then I'm going to work as one of the first thing to improve, because I'm putting myself and say, oh, it works for others, but it doesn't work for me. It's not actually acceptable. And we build technologies to actually mitigate this situation from the ground up. But I think the key is that understanding these things, having the conversation, talk about it, and also actively working to solve these problems. I don't think, honestly, we can solve this problem completely, but at least knowing that this problem exists and communicating it, and then, of course, working towards it, it helps.
All right. So there are real world examples, real felt examples. All right. So Kate, you had something you want to add?
I was just going to say, to Rachel's point, the mammogram was a great example, because not only are the data sets not representative, like let's just call it what it is. It's going to be biased. So let's factor that in and then make solutions around that. Like the density within our breast tissue in itself is different. And so we already know that going in, the data set is going to be biased. So how do we, and we know like that the breast, the tissue is more dense. And so we can then solve for that versus like, oh, it didn't catch it for myself or for Britney. And so there's such great opportunity when we are aware of and cognizant of and thoughtful to be inclusive. And to your point, we could obviously, there's 50% of the population is men. We don't want to rule out 50% of those men from STIs just because the data set wasn't inclusive, right? So it's real life, these have real life consequences. And so it is on us to be cognizant and aware and make sure as much as possible that we test for false positives as well. That's all.
I have to say something very funny. The same technology I built for removing the bias in my startup for people of color, and it was actually used in a project which is in Singapore when they use a US-based data set for breast density related bias because Asian breasts are significantly denser, and then it was giving false positive. They kind of asked my help to use my technology I built for, and I give it free, and about 20% improvement of the bias rate using my technology, and it's just communicating. I did a post about it and they said, hey, can we actually use it? I said, sure, open sourced. I give the technology to them, they use the thing, and then the CEO later write a message and said, actually it worked. 20% immediately drop using your technology. Simple as that. I think communication, I mean, sharing this information is the most important thing. We actually open source some of the parts of the technology I built for others to use.
All right, so some great thoughts all around. I also want to just recognize there's a participant, Lauren, on the chat, and she's typing in a lot of stuff for us. I'm just going to read out a few of the things that she said because it can add to the conversation. So she says, innovation fatigue is real. If your providers don't have an in-house translator or partner, they will have to depend on the vendor's word. I do agree with that. And Sound Physicians had a great model of including hospitalist nurses in the suites. We were the bridges and translators able to partner with providers with the ongoing custom education and performance-based intervention. So that's sharing a bit of experience. And also she's added here, men get breast cancer too. So yeah, that's definitely something to think about when we talk about data sets. All right, so I'm going to move into the next question. Thank you very much for the thoughts that are being shared around. If there's anybody else on the call that would like to add something, you can just type it in the chat and we will recognize you as we go along. So the next question is, we're going into patient privacy now. So what measures should be taken to protect personal health information when using AI in healthcare settings? It's a very basic question, but I think even though it's a basic question, it's often overlooked. And especially now, I come from Sri Lanka. I definitely know for a fact that this aspect of patient privacy is not taken too seriously, even though we have Data Protection Act, and it's still in the process of coming into operation. We have a long way to go. So basic question, but of significant importance in the healthcare setting because it is inherently private information. So what measures should be taken to protect personal health information when using AI in healthcare settings? Rachel, I'm looking at you to start.
Yep. Top of mind, of course. So I actually just put into the chat before I forget. I find this to be a very helpful resource for folks in the US. Usually the privacy law that everybody talks about is HIPAA. That is a federal law. In the US, it's covered health entities focus. So it's a particular industry / vertical that applies to. What we've seen in recent years is a number of US states have enacted their own state law level HIPAA-esque laws that layer on top of HIPAA. And so this tracker helps kind of make sense of all of that. But I guess more to the broad question is, there are a lot of conversations in the US right now about, does HIPAA actually do what it was intended to do in the era of modern technologies? My own personal opinion as a patient is that it does not. So the question becomes, what choice and control can we give patients, should we give patients over their healthcare information? And it's definitely a balancing act between privacy and innovation, because to get at large language models to make sure our data sets represent everybody that it needs to represent, you got to have a lot of data. But in order to use a lot of that data, you've got to make sure that you're protecting patients' information. And there are arguments about, if you strip certain identifiers, it's de-identified, et cetera. There are arguments on the other side of, in the age of modern technology and artificial intelligence, the risk of re-identification, of getting back to an individual person's health data, is greater. So there's no easy answer to anything related to privacy. I think at a theoretical high level, it all comes back to what value are we placing on trust, and what level of control via transparency do we want to give to the patients?
Okay, I'll go next. So this is something ultra close to my heart, And again, I'm going to bring different point of view. I totally agree with Rachel. HIPAA is not coming close enough to what the technology is offering right now. And it's been drafted 30 years ago, if I can remember correctly. And there was no AI, there was no ML at that time. There was phone calls and fax, and we are still using fax and pages. It doesn't make any sense to me. As I said, when I started my startup, I had this real question. And how do I make extra layer of protection instead of following the HIPAA? And what we did is, when it comes to penis pictures, this is the most sensitive thing you can think of. We didn't want to collect their names at all. We didn't want to collect any social security number or anything which can be easily identified at all. So, but that was against the HIPAA. HIPAA asks you to collect the name so that it can be protected. But we thought, like, look, I'm not going to follow this, and I'm going to actually not connect the patient's name to the image at all. So that's what we thought, and that's what we did, and we communicate this clearly to the patients. This is how the thing works, and this is how your data is saved. We were very clear. But I think the most important part is the communication. Again, certain things like Elon Musk clearly mentioned, when you want to really innovate, innovation is actually 2 steps ahead of the regulation. So there's always a gap where, again, as much as I really follow all the laws, but I think certain laws are outdated. So you have to really think of, like what I said, my first principles, do no harm. So if you think on that principles, you can actually do certain things in a way that you can actually empower more patients. Again, I'm trying to bring a different point of view because this is very close to my heart. And even though we did it, there were lots of misunderstanding of how we handle the data. So this is where the conversation is important so that people can actually understand what's applicable to them at the end of the day.
Britney, would you like to jump in and add something more on patient privacy?
Absolutely. I think to piggyback off what he was just saying, he said something that really stood out. I'm going to put it in the chat so I can remember it, about innovation being 2 steps ahead of legislation. And so I think that's very important for people who are innovating and who are creating solutions to remember. We are in a time right now where it's a very pivotal time. We're literally innovating and coming up with AI is moving so fast. It's exactly what he said. Legislation is having a hard time keeping up. So I think that we need to remember as innovators what we need to do on our side to make sure we are safeguarding and keeping our patients' information private. And so I think that, and that's a huge responsibility, but it falls on the innovator, because we cannot rely on legislation or law to protect us in this area, because like he said, we're ahead of it. We're moving at such a rate of speed right now. So I definitely think it's important for innovators to always keep these conversations and topics at the forefront of their mind when they're innovating and when they're creating AI solutions.
Right. Okay. Yeah.
Go ahead, Rachel.
Yes.
Sorry, I was just going to say, and also thinking from anyone at this chat that's thinking about themselves individually as a patient, totally right? Innovation's always 2 steps ahead of regulation. And as patients, there's risk in that. So just remember, as individual patients, when you see a new technology, we can all think of a certain DNA company that everybody was, really gung-ho to send in their DNA swabs to find out ancestry years ago. Turns out massive data breach years later, and what are the implications there, right? So just always keep in mind as individuals and again, I'm all about innovation. I work for a technology company, I love it. But I just want individuals to be empowered to know that when you interact with new technologies, they are 2 steps ahead of legislation that we just talked about. So you are putting a level of trust in them that they're taking current legislation as a baseline, not as their top tier of what they need to meet, because we just all talked about how it's not keeping up with technology, but they're using it their baseline. And if you trust them, they should be taking their own initiative to layer protections on top of that.
And just to add to that, like empowering that patient, but empowering them also with the ability to opt out. So it's great. Like I'm sitting here, maybe I want to try this, but I also want to have the opportunity to opt out if I don't want to partake within this new system or solution. I think AI audits can also be done regularly and help within that way to make sure that we are protecting privacy, because it is a non-negotiable, but we should have the opportunity to opt out.
Yes, I agree. And actually, when Rachel was talking about the whole DNA thing, I just remembered like 23andMe and what happened there. Yeah, it's very crazy. I mean, it's crazy. All right. So we have another comment from Nasha. She has said, additionally, there are likely underlying social inequalities in healthcare access and expenditures that impact how a model might be trained to predict risk, for example, cancer, especially for disadvantaged populations. The question of whether AI algorithms may need to be more generalized, trained on larger and more diverse datasets to be applied to broader populations, or more localized and applied narrowly remains to be addressed. Any clarifications on this? Any thoughts?
I think if you're trying to rule in or rule out a specific type of cancer, then yes. There was a study that I haven't had the opportunity to really dive into, but I am using it for part of my PhD research, and it is on osteoarthritis of the knee. And when you go to get tested for knee arthritis, there's a standard test that was invented in like 1951 and invented off based on a white male. And so what this AI solution has found is that there's knee structures that weren't being picked up on African Americans. And so we were being undiagnosed and undertreated for osteoarthritis. And so this is very specific to OA of the knee, but I would take that and multiply it to any diagnosis or disease. And so, yes, it'd be great to have generalized data sets, but if it's specific, then it does need to be, I think, more narrow.
Yeah, and there's always the underlying technology right now for large language models. This will probably change in a couple months, but there's a greater risk for hallucination when you get too general. In some respects, you want to take a general large language model and layer on top of it specialized data sets in order to get a more quality output. Because if it's casting too wide of a net, you could be asking it to detect breast cancer and it accidentally is trying to detect lung cancer or something. I mean, that's a super stretch of a hypothetical, but in a lot of respects, you want to take the general and get it specialized to the particular situation you have at hand.
Yeah, I was literally about at that point. I think Rachel said is very true. You have to ask the context. What is the context? What is the question we're trying to? I'll give you an example what we did like literally 1 week ago. So there's a monkeypox outbreak in DRC, which is happening right now. And we were using our general model and realized that it works about 92%. But I actually remove all the white skin models and I train on the model with only the people of color. It moved to 98%. And in that context, in DRC, there's no white people living. So you have to think of it. There's no point I'm putting that. And the model is lighter. You can actually work without internet, which is the ground reality in DRC. So you have to ask, what are you trying to achieve? If it's for everybody in the internet use, yes, sure, generalized. But if it's for a specific population, like in Africa, DRC, where you have no internet, you need a small model, but more accurate. Yes, then we create that model. I think context is very, very important.
Yeah, that's a very important point, and I love that we have examples for the things that we're talking about, which have actually been tried and tested, and I think that'll be very useful for the participants. All right, so the next question that I'm going to ask is on clinician involvement. So how important do you think it is for a clinician, for a doctor, healthcare providers to be involved in the design and development and implementation of AI tools? And what role do you think they should play? Like, how much of a level of involvement should they have in something like this? Maybe I'll start with Yudara.
Sure. I mean, as a physician, I think answer is very clear. They have to be involved at the executive level. Very simple. And I'm a huge advocate for that. I teach in the university for the exact same reason, trying to train the medical students and young physicians to be part of this new revolution. And they have to be at the executive where they have the say to say no. If I think that this doesn't look right, and they have to have the power to say no. I think that's the level of involvement I recommend clearly.
Yeah, I could not.
Just to
Go ahead.
just to add a question there. How easy is it to get them to kind of be involved in this kind of thing, or kind of to adjust their mindset to be like, this is something I would like to be involved in? Do you see a lot of
Not easy.
people want to do?
Not easy, but if you put this in the medical school level, then they are more likely to. So if I talk to 10 people in the medical school, people who are willing to, will be like 5 to 6. If I speak to 10 senior doctors, answer is 0. Nobody wants to, because there's a lot of resistance to change. But younger you are, people are more willing to change. I think it's I don't know, it's an age thing. Older you get, you don't want to change anything.
Yeah, I think that's a common problem everywhere. I don't think it's just a Sri Lankan thing, I think. Good to hear. All right, Kate. Yeah, you can go ahead.
Yeah, I absolutely, obviously, I agree that clinicians should be involved. Just as an example, the EMR software, the system that I have to log into every day, I can tell that there was 0 clinician input, and then it was all engineers. It is so clunky. And it's so frustrating because we just switched to it. Like, this is our new solution. And so I'm asking, can we contact them for feedback? Because this feature doesn't work, this doesn't work, this doesn't work. I should not have to click 23 times to get to here. Like, yes. So yes, clinicians should be involved. And it's not just, I think, the bright engineer students or somebody that has a problem that they want to solve and they start to build, they should be out there seeking a voice that's actually out there working to get that insight, to just ask some basic questions. And it would be really helpful.
All right. We're running short of time, so I'm going to move into the next question. I hope that is all right. So within the kind of same topic that we were talking about, clinician involvement, I have a slightly different question, and that is, how can we resolve the accountability dilemma when AI errors occur in healthcare settings? Because we just generally have this whole load of ambiguity as to who we hold accountable. And in that situation, do you think that clinicians should be held accountable significantly?
So I'm just going to chime in really quick from the legal perspective. This is actually interesting. The first resource I posted about for the AI health tracker, this one's a quarterly post that this organization does. I have no affiliation with them. It's just one I use to track. But in any event, what's interesting is in the first half of 2024 in the US, there were a couple, very small few, but there were a couple of bills introduced to add a layer of protection to clinicians and physicians in their use of AI. So I think it's a legal trend we will start to see pop up to try and actually answer the question you posed.
Thanks, Rachel. I'll add a little bit of again, personal context onto this. I'm an emergency physician. So in the emergency room, there are many patients comes, which is very difficult to differentiate at the beginning. We have very little information, but we are supposed to act. Certain times we have to make operations without asking the patient. And because they can be drunk, they can be overdosed with drugs and so on and so forth. So I think the most important thing is you think about it from patients, doctor's point of view and patient's point of view, like, what if it's me, what would I do? That way, I think certain things can be corrected. I always go back to my basics. As a physician, we have a Hippocratic oath. So that kind of guides us on this kind of not so sure situations and manage. When it comes to the responsibility, I think also in the emergency department, we manage risk as a system-based risk, not one doctor, but as a department or as a set of doctors, we take the risk. One junior doctor make a mistake, senior doctor is still responsible for that. So that kind of approach can be applicable to AI also. Instead of you pointing the blame to one person, I think systematic approach, a system-based approach would, in that context, would make sense. Of course, in the bigger picture, like what Rachel said, we need national guidelines on what it makes sense. But I think at this moment, it needs to be a little bit more personalized, or where you're applying, it has to be considered.
All right. Would Britney like to add something onto that?
Just really quick, I think it's exactly what Rachel said and what we've been kind of discussing, underlining that legislation, legal has to catch up to AI. And so I believe that there's going to be, just like Rachel said, a whole bunch of rollouts on the legal side and on the legislative side concerning accountability and where it should be placed, because right now we really are in a gray area when it comes to technology and those that are using it for innovation. We are in a gray area when it comes to that. So hopefully that's going to catch up to where we are right now.
All right, so we have about 5 minutes left in the meeting. So I'm going to quickly go into the last question, which is on the future outlook. So what do you see as the biggest challenge facing the integration of AI in healthcare over the next 5 years? So I would like to hear a response each from the 4 speakers before we get cut off.
I'll go really quick. Finding the right balance between innovation and regulation, which was just mentioned like in the last few set of questions, but there needs to be that balance. But it is advancing so quickly that it's challenging.
My answer is I hope that we can see more representation across the board in AI. It's so important for there to be representation from the developers, from the data, all the way down to implementation from Black and brown people. And so I hope that we can see more of us get involved in developing these solutions.
Yeah, and to echo off of Brittany, I think the biggest challenge is the challenges that were already there in healthcare before AI. And so all of us are hopeful that AI can bring a lot of good, but how can it do that without fixing the brokenness of the healthcare system that was already there? I think those questions are tough questions, and I think that will just be the biggest challenge as technology continues to advance.
I think also we need to think of one answer does not fit to all the questions. Again, if you look at the same problem in US versus Africa, completely different solution. So you have to ask the context again and then think of what it solves. So to me, what works in Africa might not work in US, what works in US might not work in Africa. So population level interventions need to be considered also.
For sure. So, I mean, I think we were able to cover quite a bit. I mean, it would be nice to have more time to chat, but I definitely think that we did cover some of the essential aspects of this. We talked about privacy, we talked about representation, we talked about clinician involvement, accountability. We also kind of looked a bit at different success stories, things that have actually worked in relation to the different challenges that we had identified. So I do think that this conversation was productive in the best possible way. And I thank the speakers for taking time off their schedule to be here today and have this conversation with me, and for all the participants for their time to join in and for interacting with us on the chat. This has been wonderful. Thank you very much. And I hope that you would continue to join me in similar conversations going forward into the future. Thank you very much, everybody.
Thank you so much. Have a wonderful day.
Thank
Be safe. Drink
you.
water.
Bye.
Thank you. Bye, everybody. See you.